Abinanti.
Thank you, Mr. Chairman. Commissioner, this is the first time we've had a chance to say hello. As a new assemblyman, I appreciate your comments and your insights. They're very helpful. We, as legislators, represent our district. We represent, theoretically, the whole state, but we can't separate ourselves from our own backgrounds. I come to this position with two parts of my background that influence a lot of the way I view things. One, like Assemblyman Wiesenberg, I am a parent of a child with autism. And I so have been involved in the autism community, spoken with a lot of parents, and heard a lot of things in addition to what I've seen myself. And I also married a woman who had a child with a very serious physical disability. He's now deceased, but he had CP. So I got to see the system work or not work the way it was supposed to. Secondly, I was a local legislator for 19 years, serving on the Board of Legislators, and before that a town councilman. So I got to see how the state interacts with local government. So I have a couple of questions given all of that in background. First of all, as a parent, I do want to associate myself and with the comments that Assemblyman Wiesenberg made. And I want to thank him for his leadership and Senator McDonald as well for his leadership in this area. And I hope to be of some assistance to them. So I think you're going to be hearing from me in the future on issues of concern to people with autism. I do have a question, if I could, on the Medicaid waiver. I'm not quite sure who to direct this question to. Is it to you? Is it to other departments? Or because parents are finding it very difficult to get a Medicaid waiver, and there seems to be a waiting list. And it's hard to get on that waiting list, and it's hard to get the services. That was clearly designed to help people with disabilities, especially for people with autism. And we know that any delay at all with a kid with autism, it could be disastrous. What do we do about that?
Thank you for the question. I'll probably punt a little bit to Mr. Moran from OPWDD. I'll just say that I'm probably not the best person to answer that question because people with a mental illness can't get a waiver at all. Okay. With one exception, which is a frank discrimination on the part of the federal government, but it's the way they set up the Medicaid program. So we cannot get home and community-based waivers, except we do have for children under 22, we can. And so we have a relatively small waiver program for children that doesn't provide permanent care, but it helps children with the most serious emotional disturbance and their families to sort of confront very difficult problems in their lives, and usually within a period of 12 to 18 months. There are only less than 2,000 people in the whole state of New York who have that waiver. So basically, if you have a mental illness, you can't get one, period.
And so we have insurance companies that refuse to cover these services. The state doesn't do it, so all we're doing is allowing the problem to fester, and it gets worse and worse and ends up in your lap with serious problems.
Well, yeah, thank you. When I was in Connecticut a gazillion years ago, I took a case on this up to the Supreme Court and lost 9 to nothing. And I guess they said essentially if Congress wants to discriminate, they can. So this has long been a really serious challenge in the mental health arena, but I think I'm venting. So what we try to do is provide a lot of other services through state resources, and Medicaid has been modernized somewhat, so we can meet a lot of people's needs with case managers and with housing programs and with appointments at a clinic and with medication treatment. But I do wish that we had the option for a waiver program.
Are we speaking out for mental health parity on the federal level?
Thank you. The mental health parity is now the law of the land. It was passed just before the health reform program. So from this point going forward, as I sort of alluded to before, almost everybody is going to have health insurance that's got parity for both mental health and also addiction treatment. And in the very long run, that's going to make a huge difference.
My second area of concern is having just left local government. I know that there are a lot of local governments that are trying to get away from providing mental health services. Westchester County, for example, just is in the process of closing down its community clinics on the assumption, which may be valid or not, I'm not sure, that the state and the privates the not-for-profits will be able to pick up the slack. Will the cuts in your department thwart those efforts to shift things to the state and to the local, to the private profit and nonprofit entities that are out there that provide mental health services?
Thank you for that concern. In a word, no. And I will say that the leadership, the mental health leadership in Westchester County is exemplary. We're working very closely with them, and the services that are being provided now by the county are going to be transitioned to nonprofit agencies, and I hope they do that with maintaining the quality. Our role as the regulator in that is to ensure that there is continuity of care, that somebody is there to pick up these services, and that people continue to get the services they need. But I will say that Dr. Mitchell's leadership in Westchester County is exemplary, and they're thinking very carefully about how to best balance maintaining services for their people with the costs to county government.
But the cutbacks in your department is not going to prevent you from providing the proper supervision there.
That is correct.
Thank you, Mr. Chairman.